The deadliest Ebola outbreak on record has health authorities worldwide on edge. The death toll continues to rise, and experts now acknowledge the situation has evolved into a crisis that might get out of control. Now, Korea is one of a number of nations taking steps to make sure the virus stays outside its borders. Kwon Soa tells us more.
Too fast to get under control. The Ebola outbreak in West Africa, already the deadliest in history, is spreading at a threatening speed in Guinea, Liberia and Sierra Leone. The latest reports show more than 50 people were infected with the virus from July 28th to the 30th. International efforts to contain the virus have accelerated in recent days. African leaders and the World Health Organization are working hand in hand on a response plan, while the U.S. Centers for Disease Control and Prevention has announced it is sending at least 50 experts to the region in the next 30 days. This comes despite 2 American health workers contracting the virus while helping in the region. Dr. Kent Brantley, who contracted Ebola while treating infected patients in Liberia, was transported to the U.S. for treatment this past weekend. His condition is said to be improving. Another infected aid worker, Nancy Wrightball, is set to return to the U.S. on Tuesday. In Korea, the government held an emergency meeting this Monday to discuss the growing health crisis. There are around 170 Koreans living in the 3 countries affected the most. The health ministry has asked the Ministry of Foreign Affairs to delay the re-entry of Korean citizens traveling home from those affected areas if they show symptoms such as fever and nausea that could be related to the disease. All passengers arriving at Korea's airports are being strictly monitored for any signs as well. The outbreak in West Africa has already killed more than 800 people and has a mortality rate of at least 55%. Kwon Soa, Arirang News.